CMV is a common infection, but it can be serious. Diagnosis for newborns must be made in the first 21 days of life. This video provides information on the care and treatment for patients with CMV.
How are you today?
I have a new baby on my caseload. They were referred for a follow-up after their newborn hearing exam. The protocol says we should test for CMV, since hearing loss can be a sign of it. Can you help me understand more about CMV?
Sure. CMV is the most common congenital infection in infants, but it often goes undiagnosed because many infants are asymptomatic or the symptoms can be subtle or missed during a clinical exam. In addition to hearing loss, other long-term health complications include developmental delays, vision problems, and seizures.
Why is it so important to test for it right away? And how do we collect the samples?
Testing needs to be done within the first 21 days of life. If we collect the sample later, it becomes difficult to determine whether the CMV infection was congenital or acquired after birth. We usually collect a saliva sample because it's simple, just a quick swab inside the infant's mouth.
Got it. So, what happens if the test comes back positive?
If the saliva test is positive, we'll follow up with a urine specimen for confirmation. A positive urine test would confirm that the infant has congenital CMV.
If they do test positive, what are the next steps?
Most infants with congenital CMV do well and show no symptoms. However, those diagnosed with it will require further testing to check for any potential symptoms. If there are symptoms, they may need to see specialists to explore treatment options, including antiviral medications.
That makes sense. And what about long-term care?
All children born with CMV need ongoing monitoring for hearing and developmental milestones, as symptoms can appear months or even years after birth. Also, congenital CMV automatically qualifies families for early intervention services in some states, so we'll want to ensure they're aware of that support.
Thank you so much for explaining all of this. I really appreciate your help.
You're welcome. It's crucial we stay informed to provide the best care for our patients.
Be prepared to identify emerging threats to your patients. AWAN has resources for nurses to support the care of people with CMV.